The cochlear implant surgery is a very advanced ENT surgery where we restore the hearing of profoundly deaf patients. These patients, the hearing aids don't work anymore. The cochlear implant has got two parts. This is the external part, it goes in the outside, and this sits on the head like this. And there is an inner part. This is the one which is the surgical part where we do the surgery and put it inside. Open the ear from behind and put this device here under the skin. So here we have created a tunnel. It goes behind the ear, behind these ossicles. We have to drill a hole here. Okay, so this is what makes it a bit challenging and complex surgery. We have to drill this, make a hole, and insert this electrode inside the ear. This is called the cochlea. This is why it is called cochlear implant. Once we implant, then we test on the table that whether all the electrodes, you can see this, these are the electrodes, whether all these electrodes are working. So we know on table, patient is still anesthetized, that the device is working. So once we do the surgery, we put it inside, we close the ear. This device is connected after 1 week to 10 days. Once the wound heals, and then you can say, okay, you can safely attach this, and this is given to the patient on that day. This is called switching on. Patients are divided into two types of patients, like prelingual and postlingual. Prelingual patients are the one who have never learned how to speak. Postlinguals are the one who have learned to speak. The speech is good. They are adults and they have lost their hearing after they have become adults. Children who are between, say, 2 to 6. 2 years is a good age. 1 to 2 years is a very good age to operate. After 2 years, say 3-4 years, the results may not be that good. The speech, because the speech, starts to develop at that age, So we must catch them young, when the speech is just developing. It is a life-changing surgery. Now they can integrate with the family, with the society, social circles. So for adults it is very good. Postlingual, it is excellent. We have a big team who can contribute to this surgery. So first thing they come to for diagnosis is either a pediatrician or an audiologist or a speech therapist. So they need to know that such a thing is there and we can do it. There are many people who are not aware, even among professionals. So we need to make them aware that such a thing exists and it can be done here in Mauritius. Get them as soon as possible. There are oncologists, certain cancers, when they're treated with anti-cancer drugs, they can cause hearing loss. So they need to be aware that we can rehabilitate, we can do something for these patients. So it is really a multidisciplinary approach to get the right candidate, right patient, so that we can give them the right advice at the right time. Overall, the operative risk is not much because we have good equipments, good microscope. It's just that we need to be very vigilant. We don't want any serious infections. And the most serious infection is meningitis. We don't want meningitis. And that is why we cover them with antibiotics. And before the surgery, we give them vaccine. I mean, as a doctor, I can say I like the expression that I see on the face of the patient after the patient starts to hear, who otherwise was totally deaf and hopeless. So it is very encouraging, very satisfying, and it keeps us going through.